Hello everyone, welcome back to sqadia.com. Today we're going to talk about differential diagnosis of diaper-related problems. Well, diaper problems vary from the diaper staining to skin inflammation in areas in contact with urine or feces. Well, inflammation of the skin covered by diapers is called diaper rash and is caused by contact with substance in urine and feces. Before moving forward to the questions, you need to ask about your patient. You must know that this rash can be aggravated by the waterproof coverings of diapers, wearing a solid diaper for a very long time, and the use of certain ointments and creams. So keep these pointers in your mind and let's start with the questions. There are 3 important questions that you need to ask about the child before making a final diagnosis. Firstly, you need to ask the caretaker of the baby if the baby cries when passing urine or feces, if there is any discharge from the baby's urethra, if the baby has nausea, vomiting, diarrhea, or fever. So, secondly, you should know that how often baby's diapers are changed. If the baby wears clothes or disposable diapers, how many baths the baby takes each week, and what soaps, powders, or creams are used to clean the baby. And the third question, and the most important one, is that you need to ask if the baby is taking any medication and if there has been any recent change in the baby's diet. Now that you're aware of the symptoms of your patient, what you're supposed to do next is the physical examination. So it is done through thorough skin exam, testing stool for the presence of blood, rectal exam, and checking for discharge from rectum and urethra as well. Now, what can cause diaper staining and what is the cause of different types of stains? So there are 6 types of stains usually recorded in a children's diaper. Red color of urine or green color of urine. And from stool, it can be black in color, green in color, red in color, or extremely pale stool can also be recorded. So there can be various causes behind each of these stains. So let's discuss them one by one. If the color of your patient appears to be red in color, if the urine of your patient appears to be red in color, this can be due to 3 reasons. Either consuming beads, or the blood in urine, or there can be use of certain medications over here. And if the urine is green in color, that might be due to the excess of bile, concentrated urine, or use of certain medications. While the variation in the stool color can also occur due to various causes. The black color of stool might be due to blood in stool, discharge of material after birth, or excess of iron in diet. Next comes the green colored stool. Well, that can be due to breastfeeding. Or infectious diarrhea. But what if the stool appears to be red in color? Obviously, that can be due to passing of blood in the stool, and this can be due to various reasons. Now, lastly, if your patient has extremely pale stool, the possible cause for that could be antacid use, fat in stool, or jaundice. So now, if you're clear about your findings, you can manage your patient accordingly or do further investigations if required. So that was all about the differential diagnosis of diaper-related problems. Stay tuned to sqadia.com for more such precise and knowledge-stuffed videos.